Welcome to Success in Medicine. I'm Dr. Samir Desai. From time to time, we like to answer questions submitted by listeners. Today, we have a question from Raphael. Raphael from Albuquerque, New Mexico asks, Dear Dr. Desai, I'm seriously considering becoming a doctor and trying to learn as much as I can about what it takes to get into medical school. I've heard mixed things about shadowing. Some people say it's something you must do. Others say it's a good idea, but it's not required. How important is physician shadowing to medical schools? Raphael, thank you for reaching out to us with this very important question. Before we discuss how important it is, let's ask a different question. Why do medical schools like to see that applicants have shadowed? The decision to go to medical school should be one that is based on an understanding of what the medical profession is all about and what it's like to be a doctor. Schools are looking to see that applicants have made an informed decision. One way to show schools that you have explored and gained an understanding of the profession is by shadowing physicians. What does it mean to shadow? It means that you are observing physicians in action with patients as they provide care and treatment. What can you learn from the physician-patient encounter? You can learn about the things that bring patients to the office or hospital and how physicians respond to these symptoms or concerns. You'll be able to see how physicians establish rapport with patients at difficult times in their lives. You'll see that the knowledge and the ability to problem solve are important to the practice of high-quality medicine. But you'll also see that non-cognitive qualities are vital, such things as warmth, compassion, respect, and empathy. You'll hear about patient stories, and sometimes you'll be witness to some amazing things. You may see a patient with colon cancer who credits the physician with saving his life because the cancer was caught early. You may see a patient who suffered a stroke, but made a full recovery thanks to life-saving clot-busting therapy. These are incredible moments, and they are reminders of the impact that physicians have on the lives of patients and their families. As uplifting as those moments are, there will be times when the prognosis is poor. It may be a patient whose cancer has returned. Perhaps it is a diabetic patient who is losing his vision. These are difficult conversations for physicians, sometimes conversations filled with intense emotions, and you'll be able to see how they handle these situations. The experience should also allow you to see what happens before and after the patient encounter so that you can develop an understanding of the other responsibilities of a physician. You'll quickly realize the delivery of high-quality care is not a solo effort. Physicians must rely on a team of healthcare professionals. To be effective, collaboration and cooperation are essential in the physician's daily work. So with all that said, how important is it to shadow physicians? It's become so important that some schools will not consider you if you haven't shadowed in some way, shape, or form. I'd like to share with you the words of the University of Washington School of Medicine, and I quote, "Volunteering with patients, conducting clinical research, or working as an office assistant or insurance coordinator in an office are all great ways to develop a broader understanding of the field of medicine. However, they are not the same as shadowing." Let me give you another perspective from the medical school at Loma Linda, and I quote, "Applicants are required to obtain physician shadowing experience and direct patient care exposure to better inform their decision for a career in medicine." So can you get into medical school then without shadowing? The answer is yes. Yes, you can. Let's take, for example, the University of Pittsburgh School of Medicine, where 78% of accepted applicants reported physician shadowing or clinical observation. So that means over 20% of accepted applicants did not report physician shadowing. However, you can be sure that those who did not report physician shadowing were able to demonstrate an understanding of the medical profession, specifically what it's like to be a doctor, through other activities. So what's the bottom line? What I tell applicants is that shadowing is extremely important. Is it absolutely necessary? No, but it will maximize your chances of being seriously considered at a broad range of medical schools. Remember that many schools will simply not consider your application if there is no evidence of shadowing. And since your goal is to secure a position in medical school, doesn't it make sense to appeal to as many medical schools as possible? Even at schools that don't have a requirement or recommendation for shadowing, keep in mind that certain members of the admissions committee may have very specific and sometimes very strong opinions about shadowing. I have heard colleagues say, "This applicant hasn't shadowed. How would she know that this is the right profession for her?" Now, let's say you're one of these applicants who lack shadowing experience, but you have explored the medical profession in other ways. If a committee member who is a strong proponent of shadowing happens to be involved in the screening of your application or is assigned to you as an interviewer, your lack of shadowing experience may remove your application from further consideration or lead to a lower interview score. So to remain as attractive as possible as a candidate to medical schools all across the country, I highly encourage you to shadow physicians. So if shadowing is important, how many hours should you spend shadowing? As you might expect, the number of hours required or recommended varies from school to school. Some schools come right out and tell you their minimum requirements. The University of Washington School of Medicine recommends that applicants shadow for at least 40 hours. The University of Utah states that competitive applicants will have shadowed a variety of physicians for at least 24 hours. Note that these are minimum requirements and that some applicants will accrue well over 100 hours of shadowing experience. I have even encountered applicants who have collected over 200 or even 300 hours of shadowing experience. Some schools will indicate that shadowing is important, but they will leave it up to the applicant to decide how much time to spend. Per the words of the Morehouse School of Medicine, "It is imperative that applicants have the experience of shadowing a physician. There is no set designation of time, but having a good understanding of the roles and responsibilities of a physician is extremely important." Note the last part of that statement from Morehouse. A good understanding of the roles and responsibilities of a physician is extremely important. Medical schools will be looking for evidence of that in your application, and shadowing is an important way to demonstrate that. Your shadowing experience will also come up at the time of the interview as interviewers assess your understanding of the medical profession. Will shadowing give you that understanding? For many students, the answer is yes. To give you an idea of how enlightening shadowing experiences can be, let me share with you the results of a study of pre-medical students. These were students who completed surveys before and after their shadowing experiences. Before the experience, only 46% agreed with the following statement: "I understand how physicians interact with patients in clinical settings." But after the experience, 85% agreed with that statement. Before the experience, only 33% agreed with the following statement: "I am familiar with what a physician does to fulfill his or her responsibilities." After the experience, 70% agreed with that statement. Finally, I would like to leave you with the words of Ashley Peterson, a student at the Philadelphia College of Osteopathic Medicine, who had this to say about her shadowing experience. And I quote, "Shadowing helped me see how adaptive physicians are. Physicians I followed chose well-researched diagnosis plans for their patients, worked well within a team, and were healthcare leaders. From watching these doctors, I began to understand which skills I needed to develop before applying to medical school. I learned more about medicine and being a physician from 100 hours of shadowing than years of researching what a doctor does." Powerful words from Ashley as she recalls her own shadowing experience. That's the type of experience I hope you have shadowing. Now that you have a better understanding of the importance of physician shadowing, how do you go about identifying and arranging such experiences? As it turns out, shadowing opportunities can be hard to secure for a variety of reasons. In a forthcoming episode of Success in Medicine, I'll discuss how to find these shadowing opportunities. In closing, thanks to Raphael for submitting this question to us. If you have a question you would like me to answer, send us a message through our contact page at our website, thesuccessfulmatch.com. Until next time, I'm Dr. Samir Desai.